Good evening, everyone. My name is Ifeoluwa Dare-Johnson, and I have come to believe that sometimes the person you're waiting for is you. You see, my father never went to school, but he made sure I never missed one day. I remember him at the University of Ilorin, proudly carrying my bags and standing in long queues to register my courses. I was so embarrassed at that time, but for him, it was his moment too. His first time at a university. He was my biggest cheerleader, always believing in me even when I doubted myself. His sacrifices and unwavering support carried me through a degree in biochemistry and a career in tech and development. But in November 2019, my world stopped. My father passed away. A stroke triggered by undiagnosed hypertension and diabetes. Two treatable conditions we just didn't know. That grief stayed buried until the world paused in 2020. It was in the silence of the lockdown. I asked myself, how many other people are losing their loved ones because they don't know what's going on in their bodies? And then I asked a second question. What can I do to change that? That's how HealthTracker was born. A digital health platform that brings lab testing into people's homes. In our first year, we conducted 5,000 tests. Today, we have delivered over 50,000 tests at home. We have created jobs and impacted over 200,000 lives through our platform. What began as a simple idea, helping people skip crowded hospitals to get into basic lab testing, has grown into something bigger. We started getting requests from women saying we want to self-test. So at first we said no, but then we thought, why not? That's how we launched HPV self-sampling kits for cervical cancer screening. And later, Lemon, the first self-sampling kit in Nigeria, made by us, assembled here at home. Why call it Lemon? Because in a country where stigma keeps young women from even saying the word STI, now they can walk into pharmacies and simply ask for a lemon. So at HealthTracker, our users, mostly women, were teaching us what was missing, and we listened. Just last year, we piloted Lola AI, a generative AI women's health assistant to support women with information ranging from menstrual period to menopause. Last month, we hosted a national conference gathering over 1,000 policymakers, innovators, medical researchers, community health workers from across Nigeria. At the heart of that conference was the State of Women's Health Report. It was Nigeria's first comprehensive, data-driven assessment of women's health outcomes across the 36 states. That report was a call to action. We cannot talk about economic progress without addressing women's health. I don't know about you, but I want to live in an Africa where nobody dies of an illness that could be treated if caught early. And where homegrown innovations can be scaled to meet the needs of our people. See, this isn't just about Nigeria. Across the continent, we are seeing a rise in African-built, African-owned health solutions. In Kenya, women are using mobile platforms to access prenatal care. In Rwanda, drones are delivering blood samples to remote clinics. See, we are innovating. Not because we're waiting for permission, because the stakes are too high, not you. We are the ones building the solutions that we need. And we're doing it with data, with dignity, and with urgency. So to all of you here today, we're not the future, we're the now. Africa needs me. Africa needs you. To be bold, to be innovative, to be audacious, to turn our empathy into action. to lean into that resilient spirit that we're known for, to turn our pain and turn it into purpose. It's time to look into the mirror. Because maybe the person we have been waiting for is you. Thank you.